Welcome to Now Innovating, a Research to Impact series at the University of Calgary. I'm your host, Julia McGregor. This is our second of 2 episodes spotlighting research to impact in the Faculty of Kinesiology, one of the top sports science schools in North America. Thanks to a generous $20 million donation from the Taylor Family Foundation, the Faculty of Kinesiology is poised to become a global leader in the study and advancement of human movement, sport, recreation, and health and wellness. This episode, I speak with Dr. Nicole Culos-Reed, a professor in the Faculty of Kinesiology and director of the Health and Wellness Lab. Her research is dedicated to improving the quality of life for those impacted by cancer through the development of movement-based programs. We discuss her research and the social innovation she has developed to offer evidence-based exercise oncology programming through the Thrive Center. Hi, Nicole, and welcome to Now Innovating.
Thanks for having me.
I'm so excited to have you on the show. Just to let our audience know first, can you just tell us more about your research and in the Health and Wellness Lab?
Yeah, so I've been a professor here since a long time, January 2001. And the work I do is really to look at the role of physical activity, exercise, sport, movement, in all its forms for individuals living with and beyond cancer. And so we've got work that spans from work in our 2 children's hospitals in Alberta and delivering exercise interventions for children with cancer, all the way through to all adults with cancer. And I think a unique focus in my lab is that we move the research to practice. So we are all about doing implementation study designs and going, what do these individuals need in the real world? And that means from the clinical setting through to back in their communities.
Excellent, and that's why I want to have on the show, a research to impact series, and I think your work is a great evidence and example of that. So Can you just talk to us a little bit more about the programs that you have developed from your research? We're talking about these patient populations, people living with cancer, tell us more about that.
Yeah, so we've had lots of programs over the years, and they've really culminated in the last 6-7 years to our 2 big ones. So ACE is our Alberta Cancer Exercise Program. And so even when I go back to when I first started, first study was in prostate cancer, then we had breast cancer, then we had head and neck, and then we had neuro, and so on and so forth, right? And so now ACE is for all. Right, it's all individuals from the point of diagnosis onward across Alberta. And so it's in collaboration with my colleague, Dr. Margie McNeely at the University of Alberta. And it's an awesome program. It's really meant to be what could we deliver if exercise was part of standard cancer care. Amazing. So big disclaimer, exercise isn't part of what's offered, right? Cardiac rehab would be our best example that many people know. Mm-hmm. You have a heart event, a heart attack, you get exercise support and wellness support. We don't have that in cancer, which is our number 1 chronic disease. So a bit always mind-blowing to me that we're not there yet. But ACE is really from the point of diagnosis, how do we get people into the program? It was all in person, but with COVID, it went online. So now it's hybrid. So it's great because it means we can reach more people. And it's an awesome 12-week, twice a week. So I've literally been doing the same program, the 12-week group-based exercise class since almost day 1. Wow. But it's tried and true and it works. And so we know through these programs like ACE, we can get fitness changes, which is what most people think of with exercise, but we get a whole host of functional benefits, so symptom management, things like cancer-related fatigue, and then we get all the emotional, mental well-being benefits, which a lot of people don't know that's what can come with exercise. And so it's all of those things that when you put it all together, what we consistently see is that individuals who engage in ACE, exercisers, and become able to be supported to build the habit of seeing themselves as someone who can exercise through this journey, they report a higher quality of life than people who are inactive. So that's our big one here in Alberta. We're pretty proud of it. It is the largest implementation exercise intervention trial in the world with over 2,700 people in our database to date.
That's fantastic.
Yeah, it's been really awesome, well supported. Alberta Innovates, Alberta Health Services, Alberta Cancer Foundation, and then our 2 universities really supporting it. And now philanthropic donations really are what are keeping us going. Mm-hmm. So that's our first example. And the second big one is Excel. So that's Exercise for Cancer to Enhance Living Well. And that took our successful ACE model, and really Alberta in Canada led the way with exercise oncology work that we've been doing. Mm-hmm. And we took that model and said, let's spread it across Canada, really trying to reach people in rural, remote regions. Mm. So even ACE in Alberta, it's our 2 big cities, Calgary and Edmonton, and then where our community cancer sites are, right? So Red Deer, Lethbridge, Medicine Hat, Grand Prairie. So if you weren't in those areas, you didn't have access to ACE. Mm-hmm. So Excel started right as the pandemic hit. but we built it to be online. So it was kind of like we saw something coming. I don't know. No, we didn't.
Premonition.
But we were able to then build this online exercise program and really reach people in all those small towns where people live across Canada, right? And across our provinces. We've got amazing network across Canada for researchers, and then we've got networks of clinicians, networks of cancer support groups, networks of fitness professionals. So those are the people that actually need to deliver it in the community. And so really both of these examples are really effectiveness implementation studies. So how do we build it in the real world? How do we make it that can be lasting, right? So it's economically sustainable, which is something that oftentimes we get these grant fundings and we built the ideal program and it doesn't actually work in the real world, right? And so that's a bit of a different twist on what we do to hopefully convince these cancer care systems and healthcare systems that exercise must become part of standard cancer care.
Definitely. I love the example too with ACE and Accelerate, like having to pivot. Like that's only one good thing I'd say about COVID is it just challenged people to like, how can we deliver this, you know, through a pandemic? And so very impressive that that you had the foresight to do online based with Excel to begin with, and then, you know, with ACE pivoting it that way.
Well, really logistics, right? Like we can't afford to have an in-person program everywhere somebody lives, but if we can bring them together online, it's harder, it's different. It's not the same as an in-person class, but we've seen really great effects. And Excel's numbers are already, I think across Canada, we're upwards of 700. So if you think of that, it's people from little small towns across the country and into our territories as well. So it's been pretty successful to date.
Fantastic. And you spoke to this a little bit, but like the impacts that you've seen from program participants, you know, on their quality of life. Like I know there's patient-reported outcome measures and like experience measures. Are you looking at that in your work? Yeah,
so we measure a whole host of things before they come into the program, at the end of the program, but then really importantly, follow-up, right? So long-term, we're tracking people because, you know, this is what I decided early on in my career. I wasn't going to do just a study, publish it, and then move on. I'm really interested in, can we get people to really integrate wellness into their usual lifestyle, see themselves as an exerciser. Because I can tell you, most of these people come into cancer, and they're the ones that are finding our programs and looking towards building exercise typically haven't had that experience already. Otherwise, they might just get back to doing it, right? So most people are pretty new to this idea of exercise, and so it's a new concept for them. So they don't see themselves as an exerciser. And so that's a big thing we're looking to change long term. But you know what we do see, so fitness changes, which is what you would hope from an exercise program, and we get really nice changes even when they're on treatment, right? So it's not like they're going to make huge gains when they're being literally pummeled with chemotherapy or radiation or they've had surgery, but we can alleviate the usual decline that is naturally going to happen when they're going through treatment, help them to maybe cope better and just give them back. Really, I think this is a central component for me for all of this. Cancer takes away your sense of control. You're thrown into the system, and it's a good system in general, but you're thrown into it. You don't have a lot of choice. It's like boom, 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 here's what's going to happen. Exercise is an opportunity for individuals to choose to do it. It gives them back that sense of control over being well, right? When all the focus is on illness, you can use this lifestyle behavior to focus on their wellness. And at that sense of control, people feeling confident and I can choose to do this today, even when I feel tired or when I'm just finishing chemo and I don't feel my best, because exercise can be modified for anybody at any time. So that control element, I think, is one of our central pieces. And then it's things like alleviating emotional distress. So stress, anxiety, and depression, right? We know you're going to experience that with a major health diagnosis. And we can use exercise, again, to probably give people back that control and then to help with those different things. We also know exercise is one of our very best tools for depression, like across the board, not just in cancer populations. And again, yet not standard part of what's offered to people who go through our mental health care system.
That's just fantastic. Thank you for sharing that. That's really interesting. So I know you've got ACE and Excel, and through that, like, so you've got the evidence-based program. So you've kind of developed the social innovation really with the Thrive Center, right? So like as a space to offer these. So can you tell us more about how it actually does operate, the Thrive Center?
Yeah, so the Thrive Center is really unique, actually. It's the only one of its kind across Canada. It's 100% volunteer run by students that we train. So it gives students this amazing opportunity to take what they're learning in their classes, mostly kinesiology, but we have nursing students, we have community health sciences, we've got science, we've got even engineering students, right? So it's an opportunity to take what they might know and put it into practice. So the students are trained, then they work with our qualified exercise professionals, mostly grad students, who lead the classes, and they help moderate, they support, they implement what we call our exercise and educate model, which is just the framework that we approach supporting people through this journey versus, oh, we're the experts, we're going to tell you what to do and everybody better get to 30 minutes a day, right? That's not the approach. Yeah. It is about meeting people where they're at, tailoring their exercise to them, but offering it in this amazing group environment that really is a moving support group. I mean, it is an opportunity for people that would never have connected, would never have met each other through the cancer journey, which can be pretty solitary, right? So they come together, but they're not just focusing on a support group talking about their feelings, they're moving and again, empowering themselves to take charge of their wellness through this journey so that as they go through it, and for many individuals, they'll live well beyond their cancer diagnosis, it really helps them to live healthier. And so that's what the Thrive Center as a physical space is all about. But more importantly, it's really the incubator for a lot of then our new ideas. Oh, can we do this? Yeah. We pilot it here, then we move it into the community. So the Thrive Center and the concept around it is actually much more than the physical space. It is building this network of trained fitness professionals who are in our community. So a lot of our programs in Alberta for Calgary run with City of Calgary Recreation, with our community partner Wellspring Alberta, and with other private fitness centers who have shown an interest in this. We provide the training, then we can bring people to that. If you think about it, like if depending where you live in the city, right, coming in to work out twice a week if it's not convenient, and hey, U of C, expensive parking.
Yes.
Yeah, hello. Everywhere, right? So it's not always the most convenient. So that's why we really have worked with our community partners. We've got the ability for people to go to this wellness source when they're going through cancer in their own community, which just increases adherence, right? It's kind of a no-brainer that if you build it, they will come. Yeah, but they're not going to come 15 kilometers through the winter weather twice a week, right?
Yeah,
it just won't happen. So
yeah, like I don't even get up to exercise, so I can't imagine like
you're feeling sick, and then you got to drive through a winter storm, and do I really want to pay for parking on campus, right? Not ideal in many scenarios. Not that we're super thankful for the space because it's well used, and we've run a ton of programs, but we also need that network and building it where people live so that they've got this source of wellness that understands what they're going through as somebody with cancer.
Definitely. That's really cool. And so, so you're testing out new programs, you're operating it. It's like, so you said that, you told me before we had this interview that, this launched in like 2013, 2014, the Thrive Center, which is fantastic. So, when, did you face any other challenges, when you were like initiating the this launch of getting the space even, or making moving these programs into like the community and getting these instructors? Like, what did you looking back from 10 years ago, what have you learned now?
God, what barrier didn't I face might be the easier question. Yes. I used to tease that when I started this, so I started doing exercise and also yoga research. I'm a yoga researcher, and I do think yoga is one of our most beautiful forms of physical activity because it can be very gentle for people going through cancer. But there's that meditative focus component, the breath focus, that can be so beneficial for our health and wellness. Typically when we exercise, we put music on, we try to distract ourselves because maybe it's not inherently pleasant, sweating and feeling your muscles work, I don't know. But with it, yoga, right, we can do this. So when I first started this, even before the Thrive Center happened, I used to tease that I like to get physicians, the healthcare providers, to refer to me. I was like, what do I have to stand naked in front of the Tom Baker? No one would listen to me. Everybody was just like, why would they exercise? They're sick, right? Which I get. And now, thankfully, that has fully changed. So our system recognizes that exercise is an evidence-based supportive cancer care tool, which makes the work we do in the Thrive Center much easier. But it's still a struggle because it's not in the system, right? So we still sit outside of it, and I've been very fortunate with the space. I've been able to, it's chicken or the egg. You build some programs, but then you need the space. I've been thankful that I've had that space, able to build this amazing, I think, experience for our undergraduate students as volunteers and that clinical hands-on experience for them. To work with a chronic disease population and see how you can impact their wellness has been really powerful. But, there's still gaps. And so because it's not systematically in cancer care, it's at the whims of funding, right? We don't get funding, programs stop. Right? Even if we know they're good and they're evidence-based and relatively inexpensive to do, everything that we do is funding-based. So that's one of the biggest barriers.
Have you seen it like taken up anywhere else? Has anyone looked at it as a model in other provinces?
Yeah, absolutely. So as I said, we've got ACE here in Alberta, which has been hugely successful, and that includes how we deliver it on campus, but also from campus to our community partners. And then our colleagues in Nova Scotia at Dalhousie took our ACE model and called it Access Out There, and we gave them that's part of, I think, one of the joys of being a researcher and connecting with colleagues is I'm very big on don't reinvent the wheel, and no, you don't have to figure out yours from scratch. Take what we've done. Yeah. It's evidence-based, right? And then so they've been able to build it out there, and what's been really interesting with Excel across Canada is that we've seen in some of these smaller communities, they've got this ability to connect deeper, more authentically, quickly with their healthcare systems. And so we have the first clinical exercise physiologist in cancer care that's going to be in Cape Breton.
Cool.
And so that system, came to us saying, hey, we have this funding, we haven't been able to put a physiotherapist in. And I said, well, would you be open to a clinical exercise physiologist? So for those that don't know, that's like your highest level of fitness designation to prescribe, screen, work with people for chronic disease management using exercise. And so they are putting it in the system. So they'll facilitate Excel out there. And hopefully that's a model then we'll be able to take back to here where, 21 years into this, not that I'm complaining, but still no CEP in the cancer care system. And I'm very fortunate. The new cancer center is going to open this fall. A beautiful shared research space, training space. We have an amazing gym in there. And we'll be able to do a lot of our research in there, but really what we're pushing for is our cancer care system to support really wellness in the journey by having that funding for that clinical exercise physiologist as part of really that integrated transdisciplinary team, right?
Yeah.
Like the healthcare teams recognize the value of exercise, but the larger RIT system, the Cancer Care Alberta Health Services, it's still not on the docket for a position that they see value in the system.
Yeah,
so
it's more like looking at equipment versus like people, right?
Yeah, you got it.
Yeah. There we go. So Nicole, do you see yourself as a social innovator? Because I see you as a social innovator, but I'm just curious, if using that term, what do you think?
Yeah. So labels are a funny thing, and I don't know that I'm would put it in my signature. Nicole Culos-Reed, social innovator. But when I look at what we're trying to do, so if you think of social innovation as really looking at the challenges that exist, complex problems, and I've always said, wellness in chronic disease management is a complex problem, and it requires us to look at it from so many different ways. And, I love the focus at U of C on this transdisciplinary scholarship and how can we take people that would look at a problem in different ways. So yeah, I do see what we're doing. We're trying to disrupt and challenge the status quo to improve absolutely the health outcomes, wellness, quality of life, survival in people with cancer by embedding exercise into standard cancer care. And so that absolutely is innovative, it's disruptive, it is all these things that not everybody's yet on board with. So I think I'm in the middle of being a social innovator, or we haven't achieved what we're set out to do. But I think with the right teams and the support within the system that we're going to hopefully get there sooner than later.
Yeah. It's definitely a long process, right? It's never I'm overnight. I'm now a social innovator.
Right.
My thing has been uptaken everywhere, and I'm making impact does take time. So it's really impressive the work that your program work that you are doing, and seeing these models taken up in other provinces, and it's very, very cool. I want to just end with some advice. What would you say to other researchers? Like yourself, might not see yourself as an innovator, but how would you encourage them to recognize the potential impact in their research and their work?
Yeah. I think there's 2 or 3 things. So one is you have to be interested in what other people are doing to learn, right? And I will say that's one of the things I love most about my job, whether it's interacting with my trainees, working with community partners, or seeing the participants. It's constantly learning and not being so tied to your way of thinking or your area of research. I have an awesome example of this. A student has recently applied, and they wanted to do something that was well outside my scope of practice, but they'd also connected with somebody else, somebody I never would have met, somebody in immunology. And he had the opportunity to come and talk to me the other day, and now all of a sudden we're taking the student on together. It's completely exercise plus immunology for looking at how we could maybe enhance treatments for people with cancer. Yeah. So really novel, really innovative and disruptive work, and we probably never would have crossed paths Never, ever, ever. And so being open to that new learning, I mean, I'm sure he thought I was a bit of a ding-a-ling because I'm like, so what you're saying here is these immune responses, and using probably even the wrong terms, but he's like, yeah, exactly. I'm like, okay, I'm going to learn. Like, that excites me. And so I think always being open to learning, being interested in what other people are doing, and try not to stay in silos. We often still have all these silos, and the U of C has done, I think, a fabulous job at trying to build some of these bridges across through institutes and initiatives and funding mechanisms even. So I think, as an individual, as a researcher, just be open to that always. And then I think the second thing is really surround yourself with great people, from your trainees through to your community partners to your colleagues, right? And build your network so that you can start to see, where does the challenge really exist, right? Because oftentimes we have a research hat on and are thinking, how do we answer this question? But is it the right question if you've got the key stakeholders with you to really identify what needs to be done? And we're seeing that with our exercise oncology. For me, it's not a question of, is exercise good for people? I mean, come on, we absolutely know it's really good for people. It's really good for people who have cancer if we can support them to doing it the right way. Right? And so if you keep that in mind and you've got the key stakeholders there, people with cancer helping to inform, we know now we've got to do kind of more on the advocacy and work with the systems to say, well, how do we do this efficiently? Which is a very different research question than, is exercise good for you? Right? And so learning throughout your career, I think, to develop that network and really connect with people that can help you maybe look at questions differently or ask different questions to get to where you're really going to be innovative, change, disrupt the system, and have more impact. And then I think the last thing is to have the passion for what you do. Sometimes it's a drain. I've over my career easily had way more no's than yeses. Like, come on. I mean, I still get told, yeah, no, that's not a good idea, done, right? And so it's, take your ego out of it. My sister has got a t-shirt that says, your ego is not your amigo, and I swear that should be the brand name for U of C. Everybody working in this, right? Like, take your ego out of it and just be like, I can learn from you. Like, I'm leading, helping to coordinate a new initiative, looking at menopause in women in the Faculty of Kinesiology. So we've built this awesome momentum team, and I'm one of the senior people for sure. And there's these new junior investigators, and I'm like learning so much from them about menopause, something that I'm going through, and so I'm like vested in this, and in cancer, people are treatment-induced menopause, right? So, this is a whole new thing that if I had my ego and was like, no, I think this is the best idea, and I've done this for years, so let's just do it my way, it wouldn't look like what it's going to look like, right? So your ego's not your amigo. Take it out of it and learn from other people and stay really passionate about what you do.
That's going to be the subtitle for this episode, is your ego is not your amigo.
My sister is going to absolutely love that. She'll be like, you stole that from me.
Very fantastic. So this is why I love my job, because I get to learn from people like you, and our audience gets to learn from your experience as well. So thank you so much, Nicole, for joining me today. I really appreciate it.
You're welcome, Julie. It's been a pleasure.
You can find links in our episode description to learn more about the Health and Wellness Lab, the Thrive Center, and the donation from the Taylor Family Foundation. If you're interested in learning how to participate in research studies at the university, including ones from Dr. Culos-Reed, visit research.ucalgary.ca/participate. And for more information on how to move your research to impact in the UCalgary innovation ecosystem, visit ucalgary.ca/innovation.